Hey there, lovely listeners. Welcome to Uniquely Wired Podcast. I'm your host, Nani. On this podcast, we uncover the beauty and nature of autism through heartfelt conversations. Let's jump in. What's up, y'all? Welcome back to the Uniquely Wired Podcast. I am your host, Nani, and y'all, I am so excited. I'm so excited for this episode to have Dr. Jessica here. And we are going to dive into a very, 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 very difficult conversation, which is dental hygiene. And if you know, then you know that kiddos that are autistic, even Down syndrome, and just different types of disability really struggle in the area of hygiene, and not just dental, but just hygiene in general. And so I am very excited for Jessica, this beautiful woman of God, to really just bless us with her knowledge and her insight on how she takes care of this situation in her dental practice. And yeah, I'm just gonna first of all let her introduce herself first and tell us a little bit about her and her family and all the great things she's doing. And then we're gonna get into this episode. So, Jessica, go ahead and tell us who you are and all the great things you're doing.
Hi, everyone. My name is Dr. Jessica Simon. I am a board certified pediatric dentist in Charlotte, North Carolina. I reside here right now, but I am from Brooklyn, New York. I have an amazing family, amazing husband, and two wonderful children, Jayla and Jordan. And, this topic for me, just special needs children and in the dental field, it's near and dear to my heart. It's something that is not talked about a lot. So I'm so happy that I was asked to talk about this today and to shed some light on some important things for parents, because I know this topic is such a difficult one for them. So I'm just happy to be here today.
No, and that's so good. Obviously, we are excited to have you. I know for me, this is very difficult, and sensitive because till this day, my daughter's 8, they still have not been able to do an x-ray. I just asked the doctor to, really get her into the surgical center that they have next door and, sedate her. Like, I'm giving them the permission to do this. I really need them to look deep into her teeth. And we know that without an x-ray, obviously that's kind of impossible to look like into the gums and all the things. And just considering my dental history, I just don't want my kids to have to go through the same thing. And if we could prevent anything now, and we can talk about this more, why not? And I'm sure you can talk about this as a dental hygienist yourself, but there's so much out there nowadays that you can do to help your children's teeth. And hopefully, some families get some insight today on this episode. But I know for her, that's what they're gonna do. It's funny though, sis, because literally they just had their dental visit like last week. And the fact that we're doing this episode now, I'm excited to learn more. Obviously Jacob has a cavity, so now we have to prepare him for a little mouth procedure, but we have to go to the surgical center. We have to do all these extra things for him specifically compared to a neurotypical child, because with him is a little more serious, right? So I'm actually excited to hear, what can you share with us about that? And I'm sure you have stories that you can share with us.
For sure. So, pertaining to just exactly what you said, we actually put a lot of children under general anesthesia, taking them to a surgery center. So, typical kids, like, neurodivergent children, like all of them, a lot of them
Mm.
actually, are put under general anesthesia. So, if you think
And this
about
is to
it,
be able to get work done.
and this is just to be able to get dental work done. So, it is, yeah.
Mm.
Neurotypical children, so typical children, a lot of them get to put to under general anesthesia because, a lot of them are fearful of the dentist. And so, what we do, our main job is to make sure that children's teeth, especially their primary teeth, are healthy so that when the adult teeth come in, they know exactly what position to come in. That is why our goal is to save baby teeth as long as possible. Because parents ask me all the time, it has a cavity, can't you just take it out? That's not the goal, because if we take out a baby tooth too early, what can happen is essentially that that adult tooth is kind of like comes in any position, and we want it to come in straight. So baby teeth are essentially like space maintainers, like they maintain the space, so when the adult teeth come in, they come in at the right position. So that is one of the main things. And our job as pediatric dentists, our job is not to traumatize children. Some parents are like, can't you just get it done in the chair? Yeah, it's possible that we can possibly get it done in the chair. But, then the child that was probably really good for an exam and a cleaning, now after we, did what we needed to do and we traumatized them, now they don't even want to come in for an exam anymore, the child that was doing really well behavior wise. So our goal is to just weigh out the risks, the benefits, and to determine what would be the best for that child. So some children, if it's just one cavity and their behavior was, I feel like, with a lot of coaching, a lot of something we call tell, show, do, which is telling the child what we're going to do, showing them, like, not everything, but showing them just to kind of make them comfortable, and then doing it. That's, and a lot of positive reinforcement. We can actually get that done if it's just one time. But, sometimes the child may have really good behavior, but because the work is so extensive and it's so many areas that they need work, that they need work, sometimes it's just best to just go ahead, take them to a surgery center, putting them under general anesthesia. Good thing about that is that the child won't remember anything. They won't be traumatized, and everything will be done in one visit, which is sometimes, better for parents instead of coming to 4 different appointments in the office. So I know I said a mouthful there,
No,
but
this is great information, though. This is great
okay.
information, sis. So thank you so much for sharing that. But obviously, there are some questions. So,
Okay.
um, I would say I wanted to ask you, how do you accommodate sensory sensitivities during dental cleanings for special needs children? And I know you just mentioned, the tell and show, which
Tell,
is
show,
something that
do.
we will, yeah, it's something that we will say like social stories, right? I guess
Hmm.
you would just call it like social stories. So,
Right.
yeah, how do you accommodate sensory sensitivities during dental cleanings? And I'm asking this because my son obviously has severe sensory challenges. I mean,
Hmm.
it's so it's so hard for him that we pull up to the drive parking lot and literally he's already freaking out and
He's
getting
freaking out.
anxious. Yeah. Same thing for haircut, because it's not even just dentists. Haircuts, same thing. It's amazing though how they remember, because I'm like, literally, you have not been here in 6 months. They go every 6 months to get their cleanup. And
They're
I'm like,
smart.
how are you already like so anxious? How do you remember this place? And yeah, they are very smart. Their memory, it's
Is
wild. Like
yeah.
it's
Yeah. They
wild. So,
remember, you
how do
know.
you have these accommodations? What are some things that you
So
use?
yeah, so some things that we use in the office. So first off, a lot of the times the children are really anxious and nervous because it's just so much stimulation. It's a lot going on. And if the office is not, a lot of offices say like, yeah, you can bring your special needs child to the office, but it's not fully accommodating. So sometimes it's super loud. It's just a lot going on, very noisy, bright lights, like, just a whole bunch of things going on, which is, you know, it really, kind of freaks them out. And also then that transcends to the parents, because they're then like, oh, I just know how this is going to go. So they already are just in their heart, just like, oh, fearful. So some things that I would recommend for parents to do is calling the office, saying that we're here, and waiting in the car, possibly until, till you're ready to go in. So you're not just waiting in a busy waiting room. Some offices have private like waiting rooms for special needs children. Some don't, but if they don't, sometimes and what we do in our office is try to make the area very calming, very relaxing, you know. When I open up my dental practice, providing like noise cancellation headphones for the children if their parents don't have them, and if they do want to wait in the waiting room, that we can provide that for them, and just making the area very calm and relaxing, and not having a lot of patients in the office, and just maybe having a designated time for these particular for these patients, so that it's just calming and relaxing for the parent. Um, Also, what I would recommend for, and I'll talk about what we do in the office, but this is also for the parent, what they can do. They can call the office to see if they can come in before their actual appointment, just to kind of like a day where it's called desensitization visit. So they would come in, just kind of scope it out, the office manager, whoever is in charge that day, will kind of show them around. This is what it would be, just to give the child and the parent a feel of what they can expect prior to even coming in. So that will kind of help with the day of the appointment. That will kind of ease a lot of their stress, and the parent, to make the visit overall just a overall better experience. So that's something that the parent can request, and if they are very accommodating, the office, they will say yes to that. One thing that we also do is put children in private rooms instead of having them in a open bay. I know most pediatric dental offices have open bays where it's just like chair next to a chair, which is pretty common in a pediatric dental office. But one thing you can request is a private room for the child, so that they can kind of be calm in there, relaxed. One thing that I tend to do for a lot of my exams and for cleanings is to dim the lights in the room. If the parent is okay with it, we do allow them to kind of lay back and watch TV. But sometimes a lot of what I see with special needs children, or children that have like sensory sensitivities, is that they're very afraid to lay back. So one thing I recommend for parents at home is to lay the child back while they're brushing their teeth at night, to lay them back. So that is something that, so when they actually come to the dentist, they know that feeling. They know that feeling of laying back. So, just brush their teeth. And it's really good for the parent at home, because then they get to see the top teeth when the child's laying back. They're not fighting them, sitting them on the countertop, just, and what I tell parents is be very mindful of that, because you don't want to brush your child's teeth trying to fight them and then you jab them with the toothbrush. So, laying the child back on the floor, and, over time, just having it very calming and relaxing. Sometimes some parents say that their child, tends to not be cooperative. So, straddling your child, and, putting your body weight on their legs, and just kind of like brushing their teeth, singing ABCs as a distraction. And that helps, so that when they come into the dental office, they know that feeling. They know what it is to lay back. So when we lay them back, they're not like freaking out. They're not traumatized. They're not ready to jump out of the chair. They feel really comfortable in that position. And also, another technique is what I tell parents is play dentist at home. Like, you're the dentist and they're the patient. Like, oh, this is what they're going to do. And so that they understand and feel comfortable with people touching their face, people touching their lips. And that is something that, parents can do at home, because this is a collaborative effort. And so doing that at home and bring them to the dentist while we dimming the lights. They can bring their favorite toy. A lot of times I tell parents to bring their favorite plushie or whatever toy that they like. We can also use that, like, hey, whatever, I don't know, Mr. Bear, we can brush Mr. Bear's teeth first, and then, to make them feel comfortable. So there's a lot of different techniques. But I think ultimately the biggest thing is having compassion and showing compassion, and being just being that light for that child, because children, that's why I love working with children, because they are able to really know if you're really there for them or not. They know, and so it's just very important to have compassion and to really, take your time. And, the parent also ultimately wants to be seen and heard. So answering all of their questions, my biggest thing is give them all the information. So when I ask them, do you have any questions? They have. That is always my goal, is to make sure I get through everything and to educate. Because at the end of the day, we're educators. So yeah, I know I keep rambling on and talking, but
No, that
yeah.
is, I mean, I'm literally like, wow, you literally drop so many gems
Okay.
in just that bit that you were talking. Like, not just for my audience, but like for me. Like, I'm
Good.
taking notes. You know, I'm going to text you after this. All right, what
Yeah.
was it that you said right there again? Granted, I could just go back and watch it, but no, like, I like that idea of laying him back. See, he struggles with that and he freaks
Mm,
out. So,
right.
10 times out of 10, I'm literally on the chair and he's on top of me. And I have to like do what you said, putting my weight on him, and not literally, you guys, those that are listening, they might take everything super literal. Like, I mean, like my legs literally around him, like holding him
Right.
down
Right.
so the doctor can brush a little bit. And, I would say mostly everything that you said, my kid's den is really good. We do a private room
Okay.
because it's the same way. The moment you go to the back, it's chair next to chair, and then the x-rays are on the side, and then the private rooms are to this wall. And they always put them on the private wall. They never see my kids in the middle on the out.
And with it, yeah.
Um Another thing he does is that I love, and he did it this time again, was should I use the loud machine, or should we just brush with regular brush? And I said, let's just do regular brush, only because, I think the vibration will just freak him out even more. Um, and you know what? It went better than I expected it, to be honest, and better than he
Good.
normally does. So
Good.
I think also him being patient, so like you said, having compassion, it really goes a long way. And it just shows that you're not just trying to rush through it and get the patient out, but rather you really want to make sure you get through this smoothly, not just for the child, but for the parent too, because that is so true what you said there. The parent feels a lot of it, a lot of the pressure. Um, the waiting, in the car, I've had to do that a lot too, just to ease their anxiety and just like, okay, take a deep breath. It's going to be okay. And, something else I will share with parents is, lots of affirmation, giving them lots of affirmation. It's okay.
Yes.
It's going to be okay. We're going to get through this, just like it's fine. Mom is here, dad is here, whoever it is. But that was so good. And I know that this is going to be very helpful to families. Because I
Yeah.
didn't even think about the whole, while you're brushing their teeth at home, definitely put them on your lap and, lay them back a
Mm,
little bit. Do it exactly how it would be in the dentist's office. So that way, when they
right.
do go, it's not like, what's going on? They're being freaked
Right.
out. So that was such a good um tip there that you
Yeah.
threw in there. So I really appreciate that.
Yeah. You know. Yeah.
Well, it's funny because you kind of answered both questions, because the second question was, the techniques or tools that you use. Well, this one is to reduce anxiety and stress in children who may struggle with unfamiliar environments. So I think you mentioned a lot of your techniques, but I don't know if there's
Yeah.
something else that will be specifically toward that. Because a lot of kids, they're always home. Like in my case, we're literally home, church. We do go out every once in a while, but it's not like every weekend or every day we're out and about. So, these scenarios when it comes to doctor's office, dental's office, haircuts, it's like hard because there's so much going on. So, maybe is there a specific technique that you use or your practice uses to reduce that anxiety? And I think you mentioned, the waiting in the car, which it's actually great. But what about once they get in though? and they have been called, and that anxiety is rising up.
So usually when we call them back, we try to take them a different direction instead of not bringing them directly into the Big Bay area, like, where there's a lot going on. So we try to bring them a different direction into the back so that, it's just kind of like waiting area, boom, bring them back. And usually like we want it to be a really quiet environment. We don't want it to be too loud or too, the last thing we want them to see is like a child that's in the open bay crying or screaming. That's the last thing that we want them to see. So we want them, and we don't want to traumatize like the parent either. It's not just really about the child, but also the parent too. So, it's about getting them in very quickly as soon as they come in from the car, not having them wait in the waiting room a long time, and bringing them directly into that quiet room where the lights are dim, you know, and just giving them everything that they need at that point, and just being very accommodating.
No, that's really, really good. I think that makes perfect sense. That's actually something for myself to even think about, if there is a different way that they can take them in so it's not so overwhelming. They're hearing so many machines when you go into
Hmm.
that open bay, and then there's the x-rays. I mean, literally they tried it and I'm like, it's not gonna work. I mean, I
Right,
hate x-rays myself. So I
right,
can't even imagine for them. I was like,
right.
literally, doctor, the only way this is going to ever happen is putting them under, general anesthesia,
For sure.
because
Right.
literally we're going to go years without knowing. And really, my biggest concern with teeth is more so my son, because even the brushing is hard for him. And so
Mm.
he grinds his teeth a lot as well.
Okay.
So
Okay.
I don't know if grinding your teeth causes the sharpness. Like, does it cause your teeth to get like sharp and like not sharp, but like,
Sure. So it definitely gets worn down and wears away.
yeah, it has
Yes.
to be
Yes.
because of that. Because I doubt that his teeth are just growing out that way. Um,
Hmm.
yeah. So that's very hard for him. So when they told me about his cavity, I'm like, oh man. So today the doctor, his pediatrician, actually saw him. And, they were saying about this procedure, he has to not eat anything after 12 midnight. And, I'm like, I'm already freaking out because he has a very poor diet. All he eats is two things, um, and drinks apple juice, of course, which I know that's mainly where, along with the goldfish, the cavity's coming from. But, um, I'm like, how, I'm telling the doctor, I'm like, can you please tell them to like give me an early appointment? Because although he's
Mm.
5, developmentally, he's not 5. So I
Right.
can't have a prior conversation with my son. Not to mention, he's also non speaking. So while she gave me this paperwork, I'm literally explaining to her, she was like, well, we only see like younger children, like early appointments. And I'm like, okay, first of all, I'm not having an 11 o'clock appointment or 10 o'clock appointment when my son is up by 5:30, 6 o'clock in the morning. First thing he asks for is apple juice and goldfish and his cereal
Mm.
bar.
Right.
Like, it's a routine. This is new to him. So give me like a 7 a.m. or 8 a.m. appointment where literally he doesn't even have to think about it. All we have to
Right.
do is take him in there. So the
So
doctor
you
did
so
put a
you did
note.
call? Okay. Good.
Well, the
Good.
doctor put a note on the paperwork stating that, mom is requesting an early appointment due to poor feeding and all that stuff. So
Hmm.
Friday, I'm going to drop off the paper. Um, and from there, they're going to schedule me. And the lady told me, she was like, when they call you for scheduling, just make sure you mention all of that. She was like, I don't schedule. So just make sure that when the person calls you, you are taking all of that into consideration. Because I
Okay.
just think it's silly that I'm like, there should be some type of accommodation for those kids that are
Absolutely.
special needs.
Absolutely. Absolutely.
So I'm like,
Absolutely.
what?
I have nothing else
Anyways.
to say about that. I agree with you. I
Yeah, it
completely agree
makes me
with you.
frustrated. It literally gives me anxiety already. And I don't even know when the appointment is. Like, I haven't even scheduled the appointment just yet. And I'm already like just thinking, because I told his OT and she mentioned that she was like, yeah, that's not going to work.
Right.
So, you know,
When it comes to surgeries, though, that's typically how they usually schedule. They try to do like the younger children first and then the older children later. But obviously, he needs special accommodations to go earlier. So
Yeah, he does.
I'm
But
hoping that they accommodate him with that for sure. For
yeah, and if
sure.
there's anything that you think of, obviously you can text me and that you think I can tell them that that would work. I will also mention, like, look, I have a friend, that's a dental hygienist, and she said I could have these accommodations. I'm gonna just throw you under the buses, even though you're not even in PA, but whatever. It is what it is. So, anyways, all right. So my next question is: are there any specific recommendations for oral hygiene routines at home? And again, you answer part of that, but
Right? There are some things.
anyways, yes, I'm sure you have some things, especially for kids with motor challenges or resistance to brushing.
Yes. So I would say what we do is a lot of just distraction techniques. So singing ABCs. We also recommend like vibrating toothbrushes sometimes, which is really helpful. Some kids really like that sensation. And sometimes the kids that just are not cooperative, we usually have two parents. If somebody, hopefully, if people have, some help at home, but this technique is specifically for two people. So it's called a lap to lap exam. So, and we usually do this in the dental office, but we also recommend that parents do this at home. And so essentially, we are laying the child's back on one parent, and the other parent, they are straddling the other parent. So that parent is focusing and holding the legs, and the other parent in the arms, and the other parent is focusing on the head to really get in there and brush. And we really like that technique because then the parent does not have to focus on the arms, the legs, and the head. They just have to focus on the head to really get in there and brush. And then, singing the ABCs, and to the point where sometimes the other second parent over time is not really even holding the arms because the child is so used to it that they're just kind of laying there and the parent's brushing. And yeah, they get to a point where the child's behavior over time, because they've become desensitized to that laying back, that they over time, you know, their behavior improves. Some children, the behavior doesn't improve, but the parents are still doing their best to get in there and brush their teeth. And, it's better than them not seeing anything at all. You know, it's better than them not getting in there like, I just couldn't brush. So at least they're doing their best and they're getting in there. One thing that we also recommend is a three-sided toothbrush. So instead of it just having bristles on one side, it has bristles on three different sides. So on the sides here and in the middle, so that when they're brushing, the toothbrush is getting to all surfaces, getting the front, the top, and the back at the same time, so that they essentially don't have to brush for the whole 2 minutes to really get in there and get out.
Yeah. And I've
So,
seen those brushes too, and you guys can actually find them on Amazon. I have seen those. I think I'm gonna start using those again with Jacob specifically, just to keep helping, and we're not there forever, like you said. But I
right.
like that technique. I've actually had, like, I've done that technique with the laps, the two parents. I've done that, I
Yeah.
believe, with Eliana in the beginning when we had first started our dental visits, and Tony will come with me. See, now it's difficult because I schedule them for the same day, and I make sure Tony takes off. And Tony goes with my daughter to one room, and then I'm in another room with Jacob. So, and they're being
Um,
seen by the same dentist, but just they're taking their time. So, while the dentist is seeing Eliana, I'm kind of just entertaining him, doing some squeezes, things like that. And parents that are listening, just like she said, use all the techniques that you know for your children, but also those that that really makes them feel comfortable, things that that at home when they're stressed and they're having meltdowns, use it. Even in public, even if people are looking at you silly and your child is 13 years old and you're still doing these things, listen, who cares? Okay? What matters is that your child is feeling comfortable, and that's the
right.
importance of it. So I do appreciate you sharing that. I think that's really good. Oh, I'm so excited for this episode. I just feel like you're dropping so many good gems that are really going to be helpful. So now, another question is, how do you ensure the dental experience is tailored to a child's individual needs, including communication preferences or behavior strategies?
So one thing, that's why it's so important for parents to be fully engaged and also to be an advocate for their child, because we rely heavily on the parent as well, like letting us know what their child likes, what they don't like, because obviously they know their child better than us. So that's why it's so important, like that the parent, like when we ask questions that, or when we ask questions that they answer it, but if they have any questions for us, that they like really ask us so that we can all be on the same page. Because, that's my biggest thing, is parents advocating for their child, not being scared to ask, not being like feeling like intimidated, but really giving us the answers that we need in the tools, like, telling us like, no, my kid won't like that. Or because we don't know, that's why, like you said, your child's dentist asked, like, hey, what do you think about us trying this or trying that? Like, you know, and it's also like a dentist that is humble, because you don't want to be like, oh, I got this, and just doing, it's not one size fits all. Everybody is different, and so obviously we want to tailor the needs to what the parent knows best for that child. So we just have to come up with different strategies and different techniques. There's so many different ways you can do it depending on what the child needs. Sometimes, like, we just can't lay the chair back all the way, because the child, like, obviously, like, you lay it back some, but you can't lay it back all the way, because the child, we're going to lose the child, so making sure we're brushing. Or my biggest thing is to always try to progress. So for example, you said that your son, you were using just the toothbrush at that appointment, but let's try to find a strategy where he eventually gets to using the spinny toothbrush. Like the goal is to try to progress so that he can. If he can't, he can't. That's fine. And I'm always like, okay, well, next time. And, but it's about some form of progression for me, because they can do it. They can. And, a lot of parents, I want to say this, that just because your child was put under general anesthesia doesn't mean that they will always need to be put under general anesthesia. Sometimes, like, I've seen children's behavior just get better as they got older, as they kept coming and they become more comfortable and it's consistent and it's the same provider, over time they become comfortable and they are laying back for that cleaning, or even if it's like a small filling, like they do well. Like, so, just because they were put under general anesthesia when they were younger does not always mean that that is what is going to happen later. For some children, yes, but that's not the case for all children. And so I want to say that
I
there
love
is some
that. I love
form
that you
of a
said that.
progression. Mhm.
Yeah, I love that you said that because we're bringing hope, right? And
Correct.
that's a big thing for me on this podcast, spreading that hope to families that feel like hopeless, or you know what? Maybe they haven't even gone to a dental visit in a very long time because
Right.
they have not been able to find that right dental place. And what Jessica is saying, excuse me, Dr. Jessica is saying, thank you very much. Let's get that right. No, but what Dr. Jessica is saying, it's true. I think we are our biggest, the kids' biggest advocate. And even when they're older, I feel like we never stop advocating for our children, no matter how old they are, whether they have a disability or not.
Right.
Children are children and they're always going to be your children. So, um, I thank God for giving me the courage to really stand strong, and like anywhere I go and take my kids, I'm always like, nope, that's not gonna work. I think this is better. And guess what? We can also shift our vocabulary, because I said it's not working now, right? It's not working just yet, but I'm hopeful that eventually my son can tolerate brushing, can tolerate bathing, can tolerate,
Correct.
laying back and, getting haircuts or whatever the case may be. just know, families, that it's not a struggle forever. It can be a struggle if you let it be and you want it to be. We have a choice. We have a
Right.
choice. And I think this might be hard for some people to really swallow, but it's just reality. You can either choose to stick where you're at and never expose your children to anything, or you can be the parents who get up, be brave, advocate for them, and expose them. Take them to that dentist visit. Listen, I know it's hard when there's other people and they're just watching and looking. Like, I get it. I know it's hard, but at the end of the day, you have to get out there.
Yeah.
You have to get out there. So, I do appreciate you sharing that, sis. Okay, last question is, what steps do you take to prevent or address oral health issues that may be more common in children with special needs, such as dental decay?
Yes.
Um, this is a really good question, I feel like, because, like you said, our dentist, he's very humble, right? For him to ask that question. And another thing is, he's also a dad. So I feel like that plays a big part too when they're parents already. And it's like, okay, I will want somebody to speak to my child this way.
Right.
So I think this comes with humbleness too, how you're approaching the family, what are you saying? And I'm sure you've had to, I'm pretty sure, have had a scenario that way. So I don't know if you can share with us an example of how you've approached these families that you've encountered.
Yeah. Well, first I let them know that they're doing a good job. You have to let them know that they're doing a good job because, it's it takes a lot of resilience. To have a child with special needs and, doing all that you can for them. So, I know that it's not going to be perfect, but all I ask is that the parent tries. Like, I really want to see that they're trying. So, you know, and we have a lot of recommendations, a lot of things that we get from our pediatric dental guidelines, like do A, B, C, but steps at a time. So the biggest thing, what I tend to see with cavities with children that have special needs, is that they're either not brushing their teeth at night. um, Parents, I would ask that parents attempt to floss. They say that they have a hard time, but flossing is a big thing as well. And also going to bed with like juice, milk, you know, and especially if you're not brushing at night, that just sits on the teeth and just erodes the teeth and just breaks it down, and even for the smaller children, and this goes for like all children, not just children, but like all children, parents giving them a bottle to go to bed with, or a cup with juice, or and one thing that I want to explain to parents is that it's better to give a small cup of juice, very small. I would say about a couple ounces, depending on the age, of juice, than giving them watered down juice throughout the whole day. It's better to drink the couple ounces of juice in one sitting than giving them watered down juice throughout the day. Because parents always tell me all the time, like, oh, it's watered down, but it still has sugar in it. And if they're drinking that throughout the day, it's sitting on their teeth throughout the whole day, as opposed to just if you give them not the watered down juice, but, regular, juice, couple ounces in that one sitting, and then going back to water, it's actually sitting on the teeth a less amount of time, even though it was the full concentrated juice versus the watered down juice throughout the day. So that is really important for parents to know as well. Um, we recommend no juice at all until they're about like one, maybe, some juice, but like for the first year, really, even like the first 2 years, we really recommend like no juice, that much juice. If you could avoid it, we recommend a lot of water and milk during meals. And also for it's really important for parents to bring their child to the dentist when they get their first teeth or by the age of 1, which parents don't know. They're like, oh, I didn't know that, when they bring their child in at 3 or 4, but we actually recommend around age 1 or when they get their first teeth, because not well, obviously for their teeth, because we want to start creating those healthy habits, but also when they're younger, and you're bringing them to the dentist, when they're 4 years old, by the time they're 4, they already are a lot more comfortable laying back. They doing all the thing because they did it when they were a year old, 9 months old. So by that time, like we kind of got all the crying done because, after a couple years coming consistently, which is also very important, coming every 6 months, then they're comfortable. And, a lot of those techniques, like you still do them, but, it's a lot easier when they're younger, if you start earlier. So,
Sorry, I was muted. That was so good. And I have to say, I'm guilty, I'm guilty, I'm guilty, 100%. Because, and obviously in our situation, it's so difficult. We brush Ellie morning, night. With Jacob, on the other hand, we struggle with both. In morning, it's even more difficult because Tony is already heading to work, when I'm getting my daughter ready for school. So there's a lot of running around, making sure I'm packing her lunch. Like, it's so much. And then first thing he asks for is juice. And that's something that we've been starting to do, is that no, even if he's crying, we have to brush his teeth. I don't care what's the issue, because the last thing I want is more cavities to continue to build. And so I will say we have stopped giving him juice, right before bed. I would
that's good.
say by now he should have been had juice. And if not, once I'm out of the interview, I'm gonna go ahead and give him his juice. So before 8:30, we're brushing the teeth and we're putting him in. And the doctor did say, the cavity is not like, whoa, the end of the world. But if we just let it sit there, right,
It'll get bigger.
it can go into the root, the nerve, and I don't want that, obviously, because then the procedure will be even more painful. So, I think that is such important things. And I know for the families that are listening that your kid will struggle with this. I get it. I know this is easier said than done. I get it. Trust me, because how many times have I heard, don't do this. And, when you're saying, no juice, that's hard, because literally we've tried water so many times and not interested, pushes it away. So literally all my kids drink is apple juice all day long.
Have you ever thought of like maybe like a sugar-free option or anything like that?
Have we done sugar free? So we've been buying more organic stuff, right? So we've been going more to Whole Foods, and that's where we usually grocery shop now. So we do get like the organic apple juice, but um I don't think we've tried. I'm trying to remember, but I don't think so. I don't think so. And you know what? I believe I did maybe 2 years ago with Jacob, and he noticed the difference. So that's the thing with him. So I've even tried buying like the organic goldfishes that are not as crazy and as bad as the regular ones. And girl, he was not with it. He was like, I know this is different. I know this looks different. It tastes different, because he smells everything. He smells
Mm,
everything. It's a sensory thing.
mm.
So it's very hard for us to transition them, and it's something we're working on. And again, I'm hopeful that eventually, they will get there.
Right.
And they'll be drinking water. I think Eliana's more, she has more of a higher chance of trying water than he does. That's
Okay.
100% sure, right at this very moment. Milk, it's funny. Jacob stopped drinking formula when he was like 11 months.
Oh wow.
Yeah,
Okay.
he was 11 months, not interested. Eliana, I would say she was already 1 as well. So they have not drank milk.
Okay.
Um,
A lot of people are doing like the almond milk, the oat
yeah,
milk, things like
yeah.
that.
I gotta
They do
figure
that
it
too.
out. I gotta figure it out. But
Yeah.
I do appreciate all of the insight and knowledge that you dropped for us on this episode because I really think it's going to be a blessing to every listener on the
Yeah.
podcast.
Mhm.
Is there any advice that you want to give the families? I know you've shared so much information, but is there anything in the back of your mind, that's tugging in your heart right now to share with that family that's possibly struggling and
Yeah.
they've lost hope on,
Yeah.
getting pursuing that dental hygiene because
Right.
they don't
It's
know what's
so
going to happen.
important.
And I feel especially for those parents because I know I mostly direct more toward the younger children, but how about those parents that, their kids are already teenagers and have severe hygiene, challenges?
So, what I will say is, don't lose hope. Don't lose hope in, finding really good providers, because there's a lot of great pediatric dentists out there. I think for the children from 0 to 18, because most pediatric dentists see up to 18, some see a little bit older, but, we there's a lot of great pediatric dentists out there. And I think it's very important to find a specialist, a pediatric dentist, because most of us in the fields, that's what we specialize in. We specialize in, being able to really have techniques to really, talk to your child, to really make them feel comfortable, to make the parent feel comfortable ultimately. So there's really good pediatric dentists out there. You can type in Google pediatric dentists specialize in special needs, and some really good ones pop up. You can call and just talk to the front desk, ask them particular questions like, do you guys provide any special accommodations for special needs children? If so, what are they? Can I come in for a desensitization visit, just a visit before you do anything, just to kind of scope out the office, to ask any burning questions that you may have, just to get a feel of the office to see if it may be a good fit for you. Before just kind of going into the unknown, like you would have an idea beforehand, which is like, no, this isn't it. Like, so that you're not just walking into something where you do not know. Um, Another thing I would say is if you can have a chance to talk to the dentist prior, you can, just to, because every child is different. So letting them know like the needs that, your child has, asking like what special techniques that do you provide for children with special needs? What techniques do you do? Is there a private room available for my child? How long are the appointments? Because you never want to feel rushed for the appointments. I think an hour, 45 minutes to an hour appointment is a good amount of time. If it's anything less than that, definitely ask if they can extend it, just so your child's not being rushed and not, because sometimes it takes a while for them to get acclimated to the room and just things like that. So you just want your child to have a really good overall experience. And it starts from the very beginning. It starts from when they walk through those doors. So, we want to make sure that they are comfortable. In terms of for the older children, I do have some parents that have a hard time because, at that point, some pediatric dentists are like, oh, they're kind of older. They need to start seeing a general dentist, but the general dentists don't feel comfortable seeing special needs children. So, finding a pediatric dentist that is willing to see older patients. I mean, there's some patients that at my current job as an associate that I see, sometimes 35, sometimes, they're older because, we want to accommodate them because we know that it's very hard to find a general dentist that will see them. Sometimes some parents, before we see them, they've been bounced around to like 5 different people, like, oh, go here, go here. And, so they're very grateful when they finally come to our office and they're like, oh, thank you. Like, A lot of those patients, sometimes we're able to see them in the chair. Sometimes we have to put them under general anesthesia in the hospital, not at a surgery center, but, because they're older and sometimes they may have like, some health complications. We want to see them in an actual hospital facility to accommodate their needs better. Um, but there are dentists out there. Please don't lose hope. Um, it just takes the first step of just first looking, do a Google searches. But they're out there.
Yeah.
There are great dentists out there for sure.
Yeah, I agree with you. And also, I meant to say, even to share with that dentist their triggers, so if lighting is
Hmm.
too much for them, make sure you're mentioning that. Look, don't put that big old light in my kid's face. It's kind of annoying, like I know they tried giving Eliana the glasses and she was not having it. She didn't want the glasses on. She was freaking out. So I had to let them know, listen, is it okay if she just sits on the chair? It's going to be hard to put her down. And with her, she's 8. So she is becoming more strong, and
Good.
bigger. She's like 50 something pounds now. So I'm like, okay, sis, we need to chill out. Jacob, on the other hand, he's only 31 pounds, so super light, tiny. I could still handle
Hmm.
him. But, there does come a time, and that's why I asked her about the
Where they're
older
gonna,
kids, because there does come
yeah,
a time where, the mom or dad might not be able to hold them down. And sometimes, you have those single moms and they're having a hard time. So, yeah, it's so much that goes into this, and we can go on and on and on talking about this
right,
topic because I know that I'm sure families that are listening have so many questions. But guys, I'm going to leave her Instagram down below and also her email. If you have any particular questions, feel free to reach out to Dr.
yes,
Jessica.
please.
I'm sure if she's able to, she'll answer your questions.
Oh, absolutely,
Yeah, so thank you so much again, Jess, for
absolutely.
being here with us and taking out of your
Of
time.
course, of course. Like I
Yes.
just really want parents to know, like there really are dentists out there that want to
Yeah.
make sure that they're being seen and heard. Even if you had a bad experience, like try your best to like, not carry that with you, but
Mm-hmm.
just kind of start over, start afresh. And if you really just need some help, like please reach out to me. I mean, I'm in Charlotte, North Carolina, but I have colleagues all over the country that are
Yeah.
amazing at what they do.
Yeah.
And, I would definitely love to connect people for sure,
Oh,
wherever city they're in.
I love that.
So,
I love
yeah.
that. Well,
Yes,
thank
yes,
you so
yes, yes.
much, friend.
Of
You guys,
course.
I
Of
really hope
course.
you enjoy. You're so cute. I really hope y'all enjoyed this episode. And if you did, don't forget to leave a review for the podcast. It really does help to boost up the podcast. So thank you again, sis. And I
Of
will see you guys
course.
on another episode of the Uniquely Wired
Bye.
podcast.
Bye,
Bye.
guys.
And that's a wrap for today's episode of Uniquely Wired Podcast. Thank you so much for tuning in and sharing this space with me. If you enjoyed this episode, don't forget to subscribe, rate, and share. Until next time.